we are going to get started here because we have a lot on our agenda. So welcome everyone. We're going to get our Spokane Regional Board of Health meeting going. I want to welcome everybody today, and it's October 30th, 2025. And I'm going to call the meeting to order and start with welcoming some new members that we have around the table and on Zoom. So we have two new members that are joining us today, and that is County Commissioner Chris Jordan and Maureen Rosette from the Native Project. Maureen's online, and I just thought they could give a little brief introduction, and then we'll finish the roll call so you know who the rest of us are. But Maureen, could you just introduce yourself, and maybe for those who are watching and don't know much about the Native Project, a little bit of background on the Native Project?
Sure. Good afternoon. My name is Maureen Rosette. I'm currently the COO and risk manager of Native Project and a citizen of the Chippewa Cree tribe in Montana. I came to Spokane to go to law school, and I stayed here and worked in the private industry for about 20 years, and then I started working for Native Project in 2014. Previous to that, I was on the board of Native Project. What we do at Native Project is that we're a outpatient medical facility. We do medical, dental, pharmacy. We have outpatient behavioral health for youth, SUD and mental health services. We just built our 14,000 square foot building right next to our other building in West Central. And so what people really don't know about us is that we serve everyone. Even though it's called the Native Project, we serve people of all ethnicities. Thank you.
Welcome, thank you. And Commissioner Chris Jordan.
Is this working? Okay.
You figured out the mic.
Yes.
First thing.
That's right. Well, I was appointed 2 days ago. Glad to be here. Chris Jordan, County Commissioner, Commissioner District 1, which is most of the west side of the city of Spokane. My district goes from 29th Avenue on the South Hill, kind of stretching north along Division, mostly up around Meade High School, 5 Mile area. So Spokane native. Before I ran for office, I was a state attorney working on child welfare cases. So in juvenile court, lots of families in crisis, seeing lots of addiction issues and other problems leading to families being really vulnerable. Been in office about 2.5 years, I think, or I guess we're getting close to 3 now. Yikes. But really focused on safety and health issues around how we're spending some of our opioid funds. So really excited to be joining this board and looking forward to learning more about the health district.
Wonderful. Welcome. Liz, why don't you start, and we'll go around and introduce ourselves around the table here.
Good afternoon, Liz Henry. I am the representative for the Kalispel Tribe of Indians.
Can you hear me? Okay. Patricia Keenholtz, and I represent Public Health Consumers.
Josh Kearns, Spokane County Commissioner.
Dr. Velasquez, Health Officer, and welcome Maureen, and welcome Commissioner.
Ray Byrne, Environmental Public Health Division Director and Co-Interim Administrator.
Dr. Monica Blakowski-May, and I represent public health and healthcare facilities and providers.
Michael Cathcart, Spokane City Council member, and here on behalf of cities and towns.
And I'm County Commissioner Amber Waldriff, and online we have Commissioner Cooney. Do you want to say hello?
I can say hello. Happy to be here.
Wonderful. And then Michelle.
Michelle Fossum, I'm legal counsel.
And Pittstongle, recording secretary.
Great. Well, welcome everyone. And we have next on our agenda, and if you look in your packets, just a reminder, all the agenda packets are in your binder, and Ann does a great job of keeping us organized here. You feel free to take your agenda packets home. That's like the front part of your binder. But then we usually leave the remaining part of the binder because that's all of the the bylaws and kind of the standing information about the Board of Health in the back. So feel free to take the agenda home, board members, when you're done with the meeting, if you want to keep track. I know we're keeping all the agendas online. Even we're keeping those up online, correct, Anne, from the last year?
That's correct. It's under the past meetings tab.
Okay. And maybe we can, if we have time, I know our 3 newer board members, Liz is a newer board member, still have some orientation to do and getting introduced to the members of our leadership team. So that'll be happening soon. And you can learn more about where to find all the information for the meetings on an ongoing basis and where to find more information about the health district. So we can only use 6 microphones at one time. That's on my notes. So hopefully we can handle that. And there is some written public comment that was received. It's in your board packet. So let's start with citizen input. Do we have anyone signed up for citizen input today, Anne? Anyone that would like to give input to the board? Anyone online? I don't see anyone online. Going once? Twice, 3 times? Okay. We'll move on to our board reports. For my report, Patricia and I were able to, see, I said your name and then look what happened. Patricia and I were able to represent the health district at the National Association of Local Boards of Health annual conference. This is the second time we've gone together, and it was a really great gathering. Lots going on around public health locally and nationally. So it was really great to, I've gotten to know a lot of the folks who are on the leadership team from across the country who are local Board of Health members. I got to meet the director of Grant County, Washington, who was there with 2 of her board members, and talk with board members from, Utah to North Carolina. So it was a really good conference. We got a very good overview of some of the items being debated at the congressional level around funding from NACHO, the National Association of County and County Health Officials. And so that was probably like the highlight for me. That woman squeezed more in a half an hour than I didn't think was possible. But Patricia, did you have anything to add from the conference, takeaways?
Yeah, I think for me, the best takeaway I got was about public health planning and different ideas around that. So I'd be happy to share that with leadership if anybody is interested, and we can follow up on that later.
Great. That was at the first part of the month. And then we had our executive committee meeting last week to plan, or 2 weeks ago, to plan this meeting and try and prioritize all the things we needed to talk about. And I know we're probably going to go to at least 3 p.m. today. If people have to leave, we put our action items up early in the agenda. And of course, I think I've been on the phone with Ray almost every day with new information from the federal shutdown and how that's impacting workers and services here in the Spokane County area. And so Ray will give us some updates. We had some good news yesterday that WIC funding now is through November, so he'll give an update on that. So the workers that we had given layoff notices to are not going to be able, they're going to be able to go back to work, which is great news. So we'll get an update on that later in the agenda. So Mary, we had a budget and finance committee meeting as well.
We did, and
Mary, you're a little quiet. I don't know if you can get a little closer to the mic.
I will try that just on my iPad.
That's a little better.
So we did have our board meeting, finance committee meeting, and most everything that we talked about in the finance committee will be on the agenda later today, as we talked about the budget proposal and the fee schedule and the resolution that we're going to be putting forward to the county. So we will see all that we talked about on the agenda here in just a little bit.
And thank you. And then the policy committee, was that last month that you gave a report? Councilmember Cathcart?
Yeah, there's not really a report to give. We did kind of finalize the rough draft of the legislative agenda, and I think Lola will probably go over that a little bit later in the meeting, so.
Great. Okay. So number 5 on the agenda is our consent agenda. These are our meeting minutes from September 25th and the vouchers. And for our new board members, those are payments that the health district has made in the last month, and those are adopted or approved by the board. We go through some of those in our budget and finance committee meetings. And new board members, don't worry, you're going to get recruited for one of these committees, so fear not. All right, do I have a motion to approve the consent agenda as presented?
Move to approve the consent agenda, items A and B.
Second.
Okay, we have a motion and second. Is there any discussion on the motion? Seeing none? All in favor, say aye.
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 Any
Aye.
opposed? Any abstentions? Okay, I think we have unanimous approval of the consent agenda. So on to our action items. Excuse me. So the first item on our agenda is Resolution 25-4, and this is authorizing the formation of a transition committee to oversee the candidate search and selection process for our administrative director. And Ray and team have already been working to put out a request for proposals for a search firm to assist us. And I know we're going to get those proposals back in here pretty soon. So the purpose of this committee, and you can look at it on your tab here, the purpose is really to help direct the process and bring recommendations and ideas back to the full board. So during this process, the full board will have constant updates, and obviously it's the full board that will be making decisions on the process as we move forward. But the idea of the transition committee was presented to me by Kim and Ray because it's been something that's been successful in the past at just helping direct the process, maybe answer questions of the search firm, look at initial candidate lists and bring that information back to the full board. So those are some examples of what this transition committee would do. So I reached out to most of you, not the new members, because that's only been 2 days ago, but I reached out and I'd like to propose a transition committee with Ray, Kim, and Dr. V as staff members. And then myself, Councilmember Cathcart is the incoming chair, Commissioner Cuny, because she's been on a previous transition committee and has that kind of perspective and experience. And then I had asked Dr. Blakowski May if she'd be willing to serve with her background with a lot of hiring at Chaz as well as the VA, and just understanding that process and looking at candidates maybe critically to see if they'd be a good fit. So I think all those people are willing to serve. If anybody else is interested, of course, you can put your name forward. But if that was the slate that I was recommending that we consider.
I'm interested in serving. This is Maureen Rosette.
Oh, okay, Maureen. So now that we have 2 more members to our board of health, originally the reason why I was choosing 4 of the board members was that we wouldn't want to have a quorum. But now we have 10 board members instead of 8. So technically another board member would not be a quorum, correct? Okay. So we could consider having 8 members to our transition committee.
5 of which are board members.
Right. Okay, so that is a possibility. I think the first action item is to actually commit to creating the committee. Is that what the resolution is about? And then we can actually make a motion to appoint people. Is that correct, Michelle?
Yes.
Okay. Any conversations or concerns about forming the transition committee? Okay. Well, I'll look for a motion then to approve Resolution 25-4. Councilmember Cathcart.
I'll so move approval of Resolution 25-04.
Second.
Okay, we have a motion and second to approve the resolution to authorize the formation of the Board of Health Transition Committee. Any comments or on the motion? See none. All in favor, say aye.
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 Okay, any opposed? Okay, the ayes have it. We've unanimously approved Resolution 25-4. And so then we need to move to B, which is actually appointing members, adopting the committee membership. So Michelle, do we just look for a motion on that?
Yes.
Okay. Yes.
Yeah, just looking at the resolution, though, I think if we are going to add another, then there might need to be a slight language update.
Oh, does it say?
In the committee membership, it says one board member representing appointed members, but that probably needs to read two. Is that your interpretation, Michelle?
Oh,
Committee-
in committee membership.
Second paragraph, yeah, committee membership, where it lists out who would who would make up the committee.
We
I
can-
didn't think that was part of the resolution, though.
It's not specifically incorporated into Resolution 2504 that I'm seeing as I scan it here, but certainly we can correct the language in that description of the transition committee to accurately reflect the number of,
Do you think it's necessary that that be updated?
I think it makes sense to do that, yes.
Okay. And is this tied to 2504 then? I was thinking this was tied to a separate transition.
I have to say, I am not sure whether it was intended to be part of 2504 or explanatory in its attachment. Anne, do you know?
It doesn't reference it. Oh, sorry.
Okay. And then in the last paragraph, it says according to the committee description on the resolution
Oh,
page.
okay.
Yeah. So then let's fix it.
Okay. Do we need to reconsider to do that?
Yep, I think that's the correct way to go about it under Robert's rules, is to reconsider the motion and amend it.
But if we all voted for it,
Since
then anybody?
Since we've already passed it, can we just amend the resolution?
I think everybody already voted, though, didn't they?
We did.
Seems like this would
Yes.
fall under a Scribner's error. Right?
Non-substantive.
Yeah, I think so. Yeah.
I
I had a
can
number wrong was all.
live with a Scribner's error if that's the will of the body here. All right, we'll live with it.
Right.
Have it fixed in post.
Got it.
Okay. Sorry, we didn't see that one until afterwards, but thank you, Councilmember Cathcart. So with that, we can always just make a quick change to that. Do I have a motion on the slate of folks to sit on the transition committee?
Could you run through the list just, and
Sure.
then I'll make a motion.
So my
to that
my
effect.
proposal was Commissioner Mary Cuney, Commissioner Amber Waldrop, Councilmember Cathcart, Member Blakowski May, and Maureen Rosette. Sorry, still learning. Maureen has expressed interest, so that would, and then Kim Kramars, Ray Byrne, and Dr. Velasquez.
I will move to approve appointing the individuals just listed by Commissioner Waldrop to be the members of the select committee, or transition committee.
Second?
Okay, any discussion on the motion? See none? All in favor say aye.
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 Any opposed? Okay, we have our transition committee. Thanks, everyone, for being so willing to serve. And again, I think the first item, so just be on the lookout for an email from Ann or a message about a meeting in November to look over the proposals that come in for the search firms. Because we'll want to have a meeting in November to do that so that we could potentially make a recommendation for our December board meeting. Okay, all right. And then item 6C, and this is the 2026 SRHD proposed fee schedule. Kim, we went through this, I think, in pretty good detail last month, and that was our touch to ask questions, get information, and hopefully we can make a decision. And this decision would only be voted on by those who are actually elected members of the board. Correct, Kim?
Correct.
Per state law.
Specific to the fee schedule
Yes.
resolution. So I'm bringing forth Resolution 25-05, adoption of the 2026 Spokane Regional Health District fee schedule. Whereas the Spokane Regional Health District Board of Health has determined that revenues from fees are necessary to provide funding for public health services in Spokane County. And whereas in accordance with Resolution 24-07, Health District Fee Policy, fees are to be determined periodically. And whereas RCW 70.05.060 provides that the board shall establish fee schedules for issuing or renewing licenses or permits, or for such services, other services as are authorized by law and the rules of the State Board of Health, provided that such fees for services shall not exceed the actual cost of providing any such services. Now therefore be it hereby resolved that the Board of Health does hereby adopt the attached Spokane Regional Health District 2026 fee schedule. So we're looking for approval by Board of Health and adoption of the 2026 fee schedule that would take effect January 1st of 2026.
Councilman Cathcart, did you have a? Okay, I just for a little explanation for some of our new board members, this the fees get looked at every year. Although in this particular group of fees, we hadn't looked at the food permit fees for a while. Ray, is that correct? And so you guys really did a close look at the amount of time it is taking to go and look at temporary food establishment, public health needs, making sure those facilities are, clean and following good practices.
Correct. We do review time every year, but because of the committee that was formed, I believe it was back in 2014, and new fees put in place, there previously had been a reserve account created, and that now has been moved into the general fund. So in relation to some of the other efforts that we've been doing, we felt now is the time to increase that. So we haven't increased those for many years. So
over 10 years.
yeah, but we do look at the time spent on the other categories every single year.
Just wanted to give a quick update to folks on that.
One
Yes.
quick question for Ray. Where are fines established at?
They're defined under under EPH general,
Okay.
and we call them fees, reinspection fees. So first, second, and then enforcement fees are also in that.
So for example, we'll talk more later about the unpermitted food vendors. Obviously, there's a lot of questions as to what the state might allow or step in with. But if we were to go out and really try to enforce those, what would be the fine structure that would be imposed?
So that falls under an unpermitted vendor.
Okay.
So, and we do have a presentation under administrative officer with Jessica, and she'll kind of go into some of that detail too.
I guess
that's where that's covered.
The crux of my question is that something that this body has the ability to set, increase, change?
Certainly.
Okay.
Okay. Looking for any other, well, let's get a motion on the table and then we can always have more discussion.
I had a question for Kim. With the the facility rentals, like room rentals, production stuff, is there any waiver for other government entities? Like I know other governmental groups use this room. Are they charged when they rent this room, when it's another government agency?
Well, Spokane County specifically, absolutely not. We
Okay.
don't charge for Spokane County.
Okay, you know what I was asking.
Yeah.
Thank you.
So,
That's enough. Thank you.
and then
Just wanted to make sure before I vote.
I think it actually does say, I thought we had a statement in there. But yes, Spokane County would be excluded from the fees. And it's also, the administrative officer can also determine who's eligible to request and use the facility. And we're just looking to reimburse for any actual costs that may be incurred when the use of the rooms are maybe set up with our IT or any other staff.
Okay. Any other questions? So for this item, just a reminder, state law stipulates that only elected members of the board actually vote on the fee schedule. Is that correct, Michelle? That's correct. Okay.
Says for any fees, it's only the elected.
Sure. So do we want to then, I'll just roll call around the room. And so if we're ready, I guess I'll look for a motion and then I'll call on you for your vote, just the elected members.
I will also move Resolution 25-05.
I'll second.
Okay, we have a motion and second to approve. I have a short-term memory here. Resolution 2505. Any discussion on the motion? Okay, then let's go to our elected officials. Commissioner Cuny, can I start with you online?
Yes, and I actually raised my hand just to state that this is our second touch of seeing the fee schedule. So just everybody got a chance to see it last week or last meeting. Again, this is being brought forward from the Finance Committee with approval by the Finance Committee. So I'll be voting yes.
Okay. Commissioner Kearns?
Aye.
Commissioner Jordan?
Aye.
Councilmember Cathcart?
Aye.
And I'll be voting aye. So 1, 2, 3, 4, 5. I think that's it. Okay. Thank you for all your hard work on that, Kim and Ray. And we'll look forward to that further conversation in our agenda about unpermitted food vendors. So we'll keep working on that. All right, we're going to action item 6D, which is Resolution 2506, and this is the adoption of the 2026 SRHD proposed budget. Kim.
Thank you. So part of the budget preparation is developing the fees on a 100% cost recovery goal. And so bringing forth Resolution 25-06 is the balanced budget for 2026. Total budget is $57,778,008. Outlining the different divisions that we have at the health district with the known revenues and fund balance use with the expenditures balance. So what we're looking for is adoption by the Board of Health for Resolution 25-06, and this would be the second touch of the actual budget.
Commissioner Cuny, did you have anything to add as the chair of the Budget and Finance Committee?
Yes, I was just looking to raise my hand. So yes, so again, this has come to the Finance Committee. We've reviewed it. We've spent many meetings and extra meetings on the budget before it came to the board last month. And so this is with the recommendation from the Finance Committee to approve it.
Okay, thank you. Any questions on the proposed budget? And I know we have 2 new members that probably have never had a chance to look at it, but we did work very hard, probably starting in July on even June on this budget, looking at the spending in 25 and whether it would be the same in 26 in all the different departments of the agency, looking at reserves, looking at, I'm trying to think of, I know some of the changes proposed are kind of keeping some positions vacant, just knowing that we have both challenges locally, state, and federally with funding. And so I appreciate all the hard work that the staff put into this, and really at the county, you know, we're doing our hard work and due diligence as well, because it's a tough time economically for local governments and districts. Yes, Commissioner Jordan.
Just a question for Commissioner Cuny. Can you just tell me a little bit as a new member about the Finance Committee? And I assume the recommendation is unanimous coming out of that committee. That would be helpful.
Yeah, so the Finance Committee, as Commissioner Waldron just stated, we've been meeting on the budget, since, I don't know, it was before June, we started talking about the budget as we were requesting from the health district as county commissioners to try to trim their budget as we were looking at trimming out our outside agencies. So this has been probably, Kim, we probably started back like in April, knowing that we were going to be having those discussions. So the Finance Committee, again, did meet on a couple of extra meetings to talk about it, to go through the budget as the ELT team looked at where their budgets could be cut, or streamlined, efficiencies could be made. So it's just been an ongoing discussion, and this is where we're at. And yes, it was Commissioner Waldriff, Patricia Keenholz, and myself are the ones that are on the Finance Committee, and we all agreed that this should move forward to the board. And like I said, it moved forward to the board last month. And so this gave a month for the board to do their look at it, to give any questions or any feedback to Kim. And Kim, last I know, there was no questions that came back to you, so we are looking for approval today.
Can I ask one question, Kim? I did get a comment from a member of the public who was looking at the budget, and they were concerned about what they perceived as reduced funding for disease response and prevention. But I don't remember that we have we haven't eliminated any positions or changed any of the programs, correct? It may just be a lower funding level because we realized that we didn't spend everything this year that we had anticipated. I don't know. It was just a comment that I received.
So that would be disease prevention response would be a division within
Right.
the health district. And that's where some of the COVID dollars were in years past.
Okay.
And so some of those reductions did.
I think this person was
and-
concerned, thinking we were cutting back on our response, especially to measles and issues that are happening, but that's not. So some of that reduction is just grant funding from COVID that went away.
Correct.
But we're still doing all the same disease prevention work. Okay, there's no empty positions intentionally or program changes.
Correct.
Okay.
Yes.
Okay. Good to know. Just wanted to clear that up because I was like, I don't think we've made any changes in that area. If anything, we're trying to invest more. I know the county that's our next item here on the agenda, is being asked to actually provide more to TB treatment. And I know that's slightly different, but it's a disease that we want to make sure we contain, right, in our community. So. Okay, any other questions about the budget? Then I'll look for a motion to approve.
So moved.
Second.
Okay, we have a motion and second. Any discussion on the motion? See none. All in favor, say aye. Aye.
Aye.
Any opposed? Okay, well,
Hey, so
congratulations. Oh, sorry.
I'm,
Do you, abstentions?
Yes, I'm abstaining.
Okay, thank you. Thanks. I thought maybe there might be an abstention because the first time you probably had a chance to look at it. So thanks, Ms. Rosette. So we'll have one abstention for the record. Okay, moving on. Congratulations, Kim.
Thank you. Thank you very much.
You've worked really hard on this, and thank you for all your work to look at every line item. I mean, looking at realistic, and I think really trying to look at when we budget and we constantly have money left over in some of those categories every year, it's like, well, then maybe we need to kind of, change our expectations. And so I think you did a really good job this year of going, okay, do we need to put aside this amount every year because we're not spending it, right? And then that's money that's left that we put it into our reserves, but it's not accessible then for the ongoing operations and staff that are desperately needed, since we know most of our funding here goes to fund people. So thanks. Great
Thank
job.
you. And it's a group effort. I mean, all the leadership across the board, ELT, staff, giving suggestions on how to do things operationally differently. So it's been a good exercise, if you will, to go through, but it's certainly not exclusive to myself or my immediate team. So thank you to everyone in the health district for that. And the guidance from Budget and Finance Committee was very helpful as well.
Thank you. Okay, well, then this is related. Item 6E, Resolution 25707, requesting the Board of County Commissioners for Spokane County to provide unrestricted funding in the amount of $1,378,960 to SRHD for the 2026 budget year. And that is just for general funding. This doesn't include the tuberculosis funding that is also a request to the Board of County Commissioners, correct?
Correct. And
Okay.
that's mentioned in the middle of the resolution. This is a separate amount from the agreement for funding TB at 525,855. And that's about $104,000 increase from 2025's TB budget. But for Commissioner Jordan, the county commissioner ask is 675,000 reduction from the prior year in 25 to balance our 2026 budget. So looking for approval for resolution 25-07.
Any questions, Councilmember?
You have a question maybe for Michelle, I'm not sure, but just on the language of a resolution that's requesting the county to give us money, I'm just curious on that. I mean, we could ask a lot of, and maybe we should ask a lot of entities to give us money, but I'm just wondering, is that necessary for the county then to give us the 1.3? Is that why we phrase it that way, that we're asking?
I'm not sure I fully understand the question, but it is traditional for the district to tell the county what we'd like them to do.
Okay, so
But
this is
they
just our
then-
formal way of doing that.
Right. And then they, of course, vote and decide what they're going to do.
Because I would just think we passed the budget, perhaps we should know and we know, but we should officially know that the money's coming in. And so I just wonder about order of operations, I guess.
Yeah. And our timing is our Spokane Regional Health
Yeah.
District's timing is a little bit off from the county's.
Yeah, I got you. Okay.
And we've been in dialogue
Oh, yeah.
with several meetings with BOCC about our ask.
Oh, yes, Commissioner Cooney.
Yeah, and just to state that there's been times, because of the timing of the budgets for both the entities, it's hard to do it, because we don't adopt our budget till the end of December. So then, or until the first Monday of December, which is too late for the health district because we need to know what that number is from the health district. But in the past, we've also had where we, as commissioners, have abstained from this vote because we will be voting on it as commissioners as part of our budget. So with the new makeup of the board, I'm not sure how that works, because the problem is we have a majority of the Board of County Commissioners that are now sitting on this committee, and I don't know if it's appropriate for us to be voting on this at this point. Michelle, you can maybe speak to that, but I think this may be more of a, just to inform the board and the county commissioners. So I'm feeling torn that I think in the past I have abstained at times. So with having four of us, I'm feeling a little less comfortable.
Yeah, you raise a good point because at least in theory, if you all voted on this, that would indicate maybe what would happen at the county commissioners meeting. So I think you're right that there, in past times, the board members have abstained, especially when you're a majority of your own board that are here. Oh, she froze. You froze.
Oh,
There you're back.
okay. Yeah. So I think I will be abstaining. I mean, I do move this. I mean, I do agree with it based on what we've done, the work we've done at the finance committee, but I will be abstaining.
Councilmember Cathcart. Okay.
Yeah, I'm happy to ask the county for money, so I will go ahead and make the motion to adopt 25-07.
Second?
Okay, we have a motion and a second. So, I do want to hear from all the other members besides the commissioners, but I do worry that with the makeup that we have, it doesn't seem like, okay. If everybody else votes yes, it works. But I do think that with the four of us, we probably should abstain. And so I will be abstaining as well. So we will call to the question, if there's no other further discussion, the motion is to support, approve Resolution 2507. So I'll call for the vote. All in favor, say aye.
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 Any opposed? And those abstaining?
Abstain.
Abstain.
Aye.
Abstain.
Abstain.
Yeah, that was my concern. That we have 5 abstentions and 4 in favor. So how does that work, Michelle?
Yeah, it's a majority of those
Okay.
voting that will carry it.
Okay. We're in a new normal. We got to get used to this. We'll keep working on it. Okay. Thank you, everyone. And thank you for the good collaboration between the health district and the county as we work through our budget challenges, trying to balance our budget for next year. We appreciate the partnership and the work to, as we've had to make tough choices about both external and internal changes at the county as well. So we will be looking at our budget very soon in the next month. Thank you, Kim.
Thank you.
All right. So this last item was one that I had brought up at our last board meeting. Later on the agenda, we're going to get to discuss the proposed Board of Health state legislative agenda, which we've traditionally done here at the health district. I mean, for years, when I was on the health board back in 2010, 2011, I think we had a legislative agenda even back then. So this has been like a tradition to adopt a state legislative agenda so we can have our voices heard through our partners like WASALFA, Washington State, local public health officials, and other groups that advocate on public health issues in Olympia. And my suggestion would be that we also would adopt a federal agenda this year. I think the county, we do a federal and a state agenda. I think the city does as well. Just with a lot of the changes happening at the federal level, my thought was maybe we should identify just a few key federal issues or funding streams to advocate on that benefit our local public here in Spokane County. So that was my intention with the resolution, was just to get support to have a federal priority list as well. Yes, Councilmember Cathcart.
Yeah, I'm totally good with it. The only comment I would make is if we're going to follow sort of the typical process, then correct me if I'm wrong, but that it wouldn't really come back for a final vote till January. Is that right? Because we don't have a November meeting, and so 2 touches.
Yes, if you normally do 2 touches, then we'd only have the December meeting, and then it'd have to be January for the second.
Okay, so is the goal to expedite this or to go through that normal process and just adopt it in January?
You know, I was thinking of a much like a 2 or 3 key items rather than, I know traditionally our state agenda's been like a couple pages. So if there's any way the policy committee would be willing, I have a couple like suggested. I've already been, when I've been speaking to Jamie, the executive director of WASALFO, Washington State Public Health officials, she was suggesting a few things. We learned a few things at the National Board of Health conference. So I don't think it would take too long to put together just a couple funding streams like public health, emergency preparedness, like continue funding or, you know, support SAMHSA funding, the substance abuse treatment funding, those types of examples. But so if the policy committee is willing to work and discuss that, I'd be happy to send some of my suggestions. We've been at the county looking at, you know, our federal agenda, and some of those items are on our agenda anyway, or I'm hoping they will be. We've had them on some behavioral health things on our agenda in the past.
Yeah, presuming this passes, yeah, I mean, we can call, you know, however many number of meetings we need to have something for the December board meeting and then leave it to board members to decide if it's ready to be adopted.
Yeah, or if it needs another touch.
Yeah.
Okay. And then in the meantime, do we need to, we didn't have on our agenda today, but I sure would love to have our new board members be able to participate on some of our committees. I know we weren't maybe going to appoint till December though, right? For the new year.
I think that's normally when it happens.
Okay. Are they able to attend a meeting as long as there's not a quorum? Or do we not allow non-committee members to attend? I'm just trying to figure that out if we had new committee members that were interested in the policy and education committee.
I don't recall any prohibition of somebody attending the meeting with the approval of the committee that's not officially a member of the committee.
I think the reason why we had 3 members on a committee was we were avoiding quorum, but now we have 10 board members, and so we can definitely have more than 3 people, but they wouldn't be able to, maybe they're just listening in or providing feedback, but anyway, it's just a thought that I know we're not officially appointing committee members till December, but if other people wanted to join, I sure would like feedback.
And on that note, I mean, it's obviously kind of challenging sometimes to get everybody's calendars coordinated, but whenever it is that the meeting is set, happy to send out some sort of a invite or whatever to the whole board, I guess, I guess we have to be kind of careful because even if it's a majority, they couldn't. But if anybody wants to reach out and say they'd be interested in observing, perhaps we could then provide that link. So
It was just a thought, but I think our plan is to appoint our committees for 2026 at the December board meeting. Okay, yes, Ann?
Just for board understanding, we appoint committee members at the January meeting.
Oh, it's
Yeah, we appoint the chair and vice chair at the December meeting.
could we do appointments at the December meeting though, so that they can participate in any January committee meetings?
If that's the will of the board.
Okay. I think we used to do that, I guess, because, you know, there might be elections, there might be new, you know, elected officials joining the board. So I understand why that might have been historically happening.
Well, and we haven't had 4 commissioners on there. There is always, we don't, at the BOCC, we don't set our committees until December. So there is always that potential that you appoint somebody to a SRHD committee and then they don't actually get appointed to the SRHD board. So I think that's also a reason why, because we don't set our committees until late or, you know, mid-December, so after the SRHD final board meeting of the year. So that's probably why we do it in January too.
We're going to have to adjust everything now that we have this new state law that has these appointments happening like in the middle or any month or any day of the year. So I just think we need to allow for new board members to serve on a committee, and the process has just changed. But I see what you're saying, Commissioner Kearns. But in terms of the new appointed members, they should be allowed to, within a month or two, you know, get on a committee. Seems like it. But anyway, yes.
Well, and when are the citizen members up for either renewal or potential change? Because that would impact that as well.
Are we at the end of the 2-year cycle?
They're not all the same, so I'd have to go back and find that summary that I did, which I didn't bring with me, I don't think, that has when everybody renews, but they're not all at the same time.
I thought the appointed members.
Dr. May, Patricia, and Charlie are
Yeah.
all on the same cycle.
And is it 2 years?
It is 2. Is this your second year?
I think so.
Okay.
So.
Wow, time flies.
I know.
So yeah, I mean, it's like as everything does keep evolving, I think we still need to keep things where we know what the regimen is. And so I would say I would still be, we're only a couple of months away, and we're allowing members, if they want to attend committee membership, to attend committee meetings. But I would say I would still keep it in January, just like we do.
Is it in our bylaws that that's the actual procedure, or that's just tradition?
I'm gonna check.
Okay. But yes, we don't have to resolve it today, but I think we have resolved that as long as we don't have a quorum, we can have people attend committee meetings in the next several months. So yes.
And I think Commissioner
Can I ask
CUNY,
a question?
Commissioner CUNY makes a great point because, I mean, say we select committees in December, and then when we appoint people for another 2 years to re-up the 3 citizen appointees, say one of them doesn't want to be on the board anymore, but we've already appointed them to a committee. So doing it in January, I think, makes sense because that's when the new terms are set for at least the 3 appointed members and for the Board of County Commissioner members as well. They start in January. So doing the committees prior to those people actually being seated on the health board just seems backwards. Because, like, for instance, when we had Dr. Polakani and Chris Patterson on there, had we done appointments in December, they didn't want to continue on the following year. So we would have been appointing individuals to subcommittees before we'd actually filled those seats. We didn't know who the people would have been. It ended up being Patricia and Dr. May. So
maybe somehow we need to, with the new state law, though, we have our tribal appointed members coming on at different times. And I just want to make sure they have a chance to participate on a committee. So maybe we need to have like a 2-prong process or something. I don't know. But why don't we bring that to the executive committee and have Michelle help us put together a good process that's equitable. Does that sound good? Okay. All right. So this is the conversation on whether we want to put together a federal agenda, list of federal priorities that for this next year here at the Board of Health. Any other discussion on that issue? Yes, Commissioner Jordan.
So just to clarify, this would be saying that the Board of Health wants to adopt a legislative agenda, then the committee would bring a proposal back in December. Is that next steps? Okay, thank you.
do we know
And
how
could I
many
just-
other health districts in Washington have a federal agenda? Like, is this common, or are we going to be one of the only ones that do this? Okay. I mean, I'm fine with doing it. I just, want folks to know, I mean, there's over 3,200 counties across the United States. And so, I just want us to kind of be, keep in perspective what impact this may have. When you look at having a state legislative agenda, some counties are bundled together. So I'm going to say there's, maybe 20 something health districts across the state. So, much more impactful when we lobby at the state level with an agenda. So just understanding how many organizations, entities, and health districts across the country there are at the actual impact that this could have. So
Well, when I
keeping
talk,
that in mind.
yeah, when I talked to Jamie, the executive director of Wasalfo, they do identify federal issues, and the resolution says we'd be bringing those forth to Wasalfo, and they go to DC. You know, I joined Jamie last year with NALBO and NACHO, all these acronyms, National Association of County and Health Officials. So I think it's because we receive so much federal funding that trickles down from the state to us, it makes it kind of important when we look at it in the context of the state funding too, because like both of those make up a good portion of our budget. So anyway, that's just my thought process. But yes, I hear what you're saying. So I would want it to be in line and supportive of what Wasalfo and other counties are doing here in Washington State to advocate. So, all right. Any other discussion?
I just wanted to say that I'm reluctant to vote on it if I can't participate in the process.
So yeah, anything that will be brought back, and you should be able to. We just established that anyone can attend the committee as long as we don't have a quorum, and we will figure out how to get new members on committees as soon as possible. But it will come back to this board, and this board will be able to amend, add, change before any decision is made. So the committees is just kind of like getting the first initial work product put together, and then the board has a chance to alter, change, and either adopt or not adopt. Does that make sense, Maureen? Okay.
Yes, thank you.
Okay, great. Any other comments? So looking for a motion on this resolution.
Move to develop a federal legislative position.
Second.
Okay, any discussion on the motion? Seeing none, all in favor say aye.
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 Any opposed?
Aye.
I think I heard all ayes. Any abstentions? Okay, great. We've approved that. So thank you, Policy Committee, for taking it on. And we'll get information out. So if folks want to jump into that committee meeting, we can have up to 5 people attend the meeting without having to do the, make it an official publicly noticed meeting. Because no decisions are made in those meetings. They're discussions and bringing forth to the full board proposals, correct?
Correct.
Okay. All right. So then we're going to move into item 7. Michelle, can you state, this is our executive session, and we're just a little bit over time, but we're doing pretty good, folks. Michelle, if you can give us the reason for the executive session and how long we would be approximately in executive session.
Sure. So the one reason will be labor negotiation guidance pursuant to RCW 4230-140 sub 4. Then litigation and potential litigation pursuant to RCW 4230-110-1I. And performance of a public employee pursuant to RCW 4232-110-1G. And I think we were planning on half hour to start with for all of those items. And staying initially will be the board members, myself, Ray, and Danielle. Did I get that right, Ray?
And Kim.
And Kim. Thank you.
Okay, and then will you be calling in other people later?
Some people will be leaving.
Okay.
Yes.
Okay. We're starting with the most people. Okay, so we're going to break here at 1:33, and for 30 minutes. We will go into an executive session at 1:33 for 30 minutes, and if we have to extend, we will make an announcement. Thank you. Oh, okay. There it is, on air. Okay, we're back. Back in open session, Mr. Byrne, thanks for giving us some administrative updates. And first off, treatment services report.
Yeah, and just wanted to give two real quick updates first. Just want to say thanks to the new members that are joining the board, and we welcome you. Look forward to working with you in the future. And then also, we had a meeting with the Secretary of Health for the state of Washington on Tuesday, which we had multiple staff participating in that. Had about a 2-hour conversation just back and forth. It was just kind of a general conversation with him, which went really well. So we are looking forward to working with him in the future. So, all right, now just the treatment services update. Thanks.
Okay. Do the slide. Got it. Okay. Good afternoon. I'm April Pinkney. I'm the Associate Director at Treatment Services, and I'm going to go through our report. Okay, here we are. So the update for September, as you'll recall, last month there was a deficit. For September, we have a $3,886 deficit, but still with a $448,651 surplus. And all of that is in your handout. So our numbers for our intakes, you'll see days from referral to admit, intakes that were turned away, intakes that returned and were admitted, and then transfers and discharges. And then our dispensing, we have our unique OTP patients served, unique courtesy dosing patients served, our methadone doses dispensed, and then buprenorphine naloxone doses dispensed. Are there any questions?
Just for context, for Maureen and Commissioner Jordan, the board had asked this year that we get updates at every board meeting about how treatment services is doing. And these were the data points over the last year that we've worked on together. And so we get an update on these statistics each month. And as you can see, the intakes turned away were a concern earlier in the year. And I'm glad to see that that number has really gone down. So congrats.
A question.
Yes,
I had
go
a
ahead.
question.
Go ahead.
I had two questions. One was about why do you turn intakes away? That was a question. And the second was the naloxone doses dispensed went down significantly July, August, September. I understand those are warmer months, but were there less overdoses? What's the deal there? Because they're like in the hundreds and went down to 17. So I was curious about that.
So when we turn an individual away, there's a multitude of reasons. It could be a staffing issue. It could be that they don't meet criteria for the program. And so generally that's the reasons that we turn them away, and they'll come back the next day and hopefully we'll be able to admit them. The buprenorphine naloxone, that's our Suboxone patients. So we have a small number of them. I'm not exactly sure. Can you speak to the?
We have one right now, one patient that has Suboxone, at least that we're dispensing monthly.
I'm not sure the months prior why there was such a reduction.
Yeah. Just higher counts
Yeah.
of patients that were on it.
And sometimes are those patients that are from out of the area that are, or is that not this number?
generally.
Okay.
General.
I know sometimes people, when they're in the area, can go get dosing when they're away from their normal clinic.
Right.
But yeah, it's interesting. So just many more patients using methadone and not the other treatment.
Yes. Yep. Any other questions?
Yeah, I guess wondering a little bit about why the deficit this time. The numbers are pretty close to what they've been. And so just curious what has happened there. Is it just kind of an odd month with staffing? And then with the increase that in hours and access, I don't see anything that kind of gives us a sense of what that has done to boost the numbers. But just looking at these, it doesn't look like there's been that drastic of a change.
Right. I think the expansion of hours, what that's doing is just our patients are coming throughout the day now. We have not increased our intakes with the expansion yet. So we have not gone to the capacity of what's intended. So I think there's other reasons why maybe our numbers are not or haven't increased with other clinics in the area. There's factors with the weather and just a multitude of things that can contribute to that. So when we are able to expand hours for intakes on Saturdays and then in the evenings, we're anticipating an increase there, but we won't know that until we're able to do that.
So just to clarify, the dispensing hours extended to 1:15. That's just those patients who are already they're already a patient in the clinic.
Right.
Okay, so when are you planning to open up the extended hours into the evening? Because right now, just for the new members, you close to admitting new patients at what time?
We've extended that, and we are able to see patients up until 12 o'clock, 1 o'clock. Really, we don't necessarily turn people away now. We used to have everybody come at 5:45 a.m., and that was our intake time. Now we are seeing patients well throughout the day. But we are still recruiting for the expansion hours, so until we are able to secure those positions and onboard them, we won't be expanding past the 1:15.
And just remind us it would go till 6 p.m. instead of the 1 p.m.
That's the intended
Okay.
goal, yeah.
So we haven't opened up till 6 yet.
No.
We're still working towards it. I think the goal was like November sometime,
Right, and
depending on the positions you could hire.
Yeah, so that may be a bit longer. It will be a bit longer.
So now you don't have to get there at 5:45.
We're still
get
there.
your
We're
dose.
still there at 5:15, but yes, but they can come later, and they do.
Yes, Patricia?
I have a question. This is jumping a little bit ahead to the expansion stuff and kind of hypothetical, but attending the Safe and Healthy Spokane Task Force discussions yesterday and the day before, there's a lot of talk about the jail and possibly making it so that inmates in the jail could sign up for MAT once they're in the jail instead of it already being restricted to people who are already signed up for SRHD for treatment services. Would the expansion, if that were changed, where inmates were then allowed to sign up for MAT, would the expansion be able to support that increase in numbers?
We currently do intakes at the jail. So we have a community staff person who goes to the jail regularly and does intakes. So
doing more.
So if we're open longer, yes, the potential would be to do those. There's a little bit of an issue with the jail staffing, being able to have the accessibility to the jail and the inmates. But like I said, we're doing maybe 2 to 4 intakes a week with the jail.
And is SRHD the only treatment services that's providing methadone at the jail, right? Yeah, that's what I thought.
So we do courtesy dosing or guest dosing for any of the clinics outside of enrolled in our SRHD. So if they came from across the state, we would guest dose. If they came from Camas, we would guest dose them.
Okay, so it's just, there's one provider, but it provides for all of the places that have people enrolled. That's great. Thank you.
Yep.
Commissioner Jordan?
So are the jobs posted then for the folks you hope to bring in to expand?
They are, and we've
Okay.
been doing interviews
Oh, good.
regularly.
Great, thank you.
It looks like on the slide, sorry, we're jumping ahead. We'll
That's
let you
okay.
catch up.
That's okay. So we'll go treatment services monthly numbers. We have our individual counseling sessions, telehealth group, and counselor assessments. And then here is where we're doing our jail doses, unique jail dosing patients served, and then jail assessments. So for September, we did 4. Any questions? These are our medicals, so our annual physicals and assessments. And then this is where we talk about our expansion. So we are currently recruiting for the RN and ARMP position. We are dispensing until 1:15, and our Saturday hours are 7 a.m. to 10:45 a.m. And we are seeing our patients regularly on Saturdays as well. Any questions?
So just those two positions left, which are critical
Right.
positions. Yes, Dr. Blakowski-May?
Yeah, so looking at the budget stuff, it looks like there was just less funding from Medicaid, particularly kind of a significant amount in September, which may have been part of why the deficit was what it was. Is that because timing wise, is it just the claims didn't go through, or is there a delay in getting that money from the insurance company?
There was a billing issue. I'm not exactly sure about that. I think what I am understanding is that with our expansion and recruitment, that it has increased our expenses. And so that's why we're seeing the deficit, because we have not brought in more numbers or more individuals. And so that's kind of the explanation for the deficit. I don't believe, and I don't know, Kim could maybe speak to that at all, but I don't think that's a major contributing factor, the Medicaid.
Yeah, definitely the salaries went up when you hire more, more people, so for sure. But hopefully adding the critical people who will actually be able to bill for the encounters,
yes,
that should really help the expansion.
Absolutely. Any other questions? I think that's
All right.
it.
Thank you for the update.
Yeah, thank you.
Appreciate it.
So just a couple updates. We did get really good news yesterday on WIC. So for clarification, we had issued layoff notices effective tomorrow. So they have continued working. They hadn't been laid off yet. So with the new money, so we had estimated our costs on a monthly basis at about approximately $271,000. We were notified yesterday morning that the state was forwarding that money to us. So that's going to delay the layoffs. So we were able to extend the layoff period through the end of November. And hopefully, federal government, we have that funding source before then. So that was great news that we had. So there'll be no interruption in WIC services between now and the end of November. Not sure how far that food funding is going to carry either. Currently, we've been notified, and the hope is mid to late November on the food for the cards. I don't think we've heard anything else. We do have 2 meetings every week with updates, so it's always subject to change. But as it is right now, we're fully funded through the end of November.
So just a operational question. So each clinic sees women and children who come in, they assess them to get on the program. But then is it the state that holds the money, that puts the money on the cards once they're admitted into the program? So that isn't a funding stream that comes through us. The funding stream that we get is to employ the workers that are working with the families to assess, support, weigh the babies, see what the health of the children are, and support the families. But the money that goes on the cards to go to the store and purchase the food, that's all run through the state.
Correct.
Okay.
Yes.
Yeah, so they're two separate funding sources.
Okay.
You'll hear food funding, which is directly on the cards for the participants, and then the WIC admin costs, which is the operational, which relates to our team and our contracts for lease rentals and all the staffing. And that's what we were not receiving was WIC admin. There was not a guarantee of funding from the state as of October 1st, which is what triggered all the layoff notices. And then each week we were getting additional information that there's a little bit of money that could be used for WIC admin, but without a guarantee is what put us in the situation of the layoff notices. But super happy about the notification yesterday to support the health district, specifically with the 6 clinics with WIC admin funding through November.
And how many workers do you have at those 6 clinics?
There's 29 total.
Okay.
including management.
Yeah.
Well, I'm sure they were all very happy to get that news. And thank you to the two of you for being on all these calls and working so hard with the Department of Health to try and keep those clinics open. Questions on the WIC program or the clinics?
Do you have an approximate number of clients you see? And then are your personnel, your admin people, do they have to be specifically trained? Like you mentioned weighing the baby and stuff like that, but what is their background? Just curious.
Why don't you speak to that?
I'll do my best coming from finance, but my understanding is we have 10,000 participants through our 6 clinics under SRHD's management. And then we do have different levels of WIC certifiers. And my understanding is they do have specific trainings that they have. And then we have a level 1, level 2 WIC certifier. And then we have registered dietitians on staff, community worker, administrative assistant, and management.
Kim, can I ask for clarification, is that 10,000 families? Is that 5,000 parents, 5,000 babies? Is that,
Yeah, that's a great question. I've just, the participants is what's been noted, so I don't know if that's probably tied to, I can't say actually, whether it's specifically each card is considered a participant or how many maybe children within that unit are counted. Yeah.
Okay, thank you.
Sorry, I could certainly get the number for you.
Okay, if you could, that'd be great.
Yeah.
Thanks.
Yeah, I
And
believe
that'd probably
that
be good
10,000
information to have for our media team when there's questions. Yeah. Well, I'm so glad because I thought the conversation today was going to be very different with clinics closing. So I'm glad to hear that. I'm hoping we can, we're going to have the federal government get together here in the next month and continue the funding. So thank you so much.
And I would say we're a little bit unique in being able to be open all the way through November with this commitment of the dollars. It's been across the state. It has varied significantly. Some clinics shut down October 1. There's others that went down to a scaled staffing model. DOH laid off 53 individuals and has retained 10. So it's changing by day and what each agency can handle the risk as far as whether they're going to be reimbursed or not. So we're really blessed to actually get this 271, which is our projected expenses for November. But if you talk to others across the state, it does look different on whether they're able to stay open or not. The big message is the food funding to the participants that are enrolled, though, is projected to go through mid to late November. The shutdown of the SNAP benefits is changing that possibility of the WIC food funding running out faster in projections because there is a recognition that some of those SNAP participants would be eligible for WIC. So it's fantastic that we're open to maybe enroll some of those individuals, but there may be a faster draw on the WIC dollars, WIC food funding.
I just want to say the overview says that the participants includes women, infants, and children, not just mothers, as the program serves pregnant, postpartum, and breastfeeding women, as well as infants and children up to age 5. So my guess would be it's all of those people in that 10,000 number.
Thank you for that.
All right. Well, hopefully we'll still have good news next meeting.
Yeah, and also just want to recognize the program managers as well as the division director have been in constant communication with DOH also, so they played a big role in this also. So it's kind of the squeaky wheel thing.
Yeah,
So
a tremendous partnership with Washington Department of Health, working with our team, and it didn't go unnoticed also that we had Secretary of Health this week here, Dennis Worsham, and a couple of his members come and visit and hear from the health district on all of our programs, but certainly was made aware of our predicament this week.
I want to say too that we were motivated to continue covering it. We just didn't know how long that could be. And so it is a big relief. And I
mean, the last conversation we had was taking some of our reserves just for a few days to get to the end of the month. And the challenge is 270,000 a month can start to really, eat into our reserves. But but that was the conversation we were going to have. You know, what can we do? So keep us informed.
Yeah, and just also, so just a quick update on that too, is the money that we have gotten so far still leaves us short about 60,000. So
Month of October.
yeah, so we're still pulling some from reserves to cover that amount, but this certainly gets us way closer, so.
And we may have the opportunity to backdate and backbill, but we don't know that yet until they open back up and we see the contract actually executed.
Yeah.
So foundational public health services, state funding.
Yes. So we wanted to just to bring you up to speed on foundational public health services, FPHS. It is a line item in our budget for currently in 25 as well as 26. Going from 2025, the FPHS funding runs July through June. So July 1 of 25 was a new funding period for our FPHS. SRHD did receive a reduction of $100,000 that was determined at the state level. And then we also had a reduction of $50,000 that we as an agency were able to determine where and how it was impacting within our health district. And so we were able to use the chronically underspent buckets of money that were so prescriptive that we didn't always utilize those dollars. So we did have a $150,000 reduction as of July of 2021, or excuse me, July of 2025. The funding going for the next period that ends June of 2026, those dollars have been advanced to the health district. So that's one of those funding streams that we normally would get every July and January. So we received $5.886 million for the next 12 months, beginning July 1 of 2025. And we've been informed through WASOLFO and through some meetings that the forecast for the FPHS funding as early as January of 26 is the funding's coming in less than anticipated, and there's a $4 million shortfall for this grant period. So although we've been advanced the $5,886,000 across the system, we're going to be looking at a reduction to FPHS as early as January or first quarter of 2026. The conversations are just starting in WASOLFO about where the cuts may take place, and there's 4 sectors of FPHS: the State Board of Health, Tribal, Washington Department of Health, and then all the LHJs. And so those conversations are just beginning. What would be the impact? Will they be system-wide? Will they be prescribed across the state, or will each LHJ be able to make decisions on how that reduction is implemented across their agency? So we wanted to bring that to your attention. It's still, the 4 million is still a prediction, and it isn't a solid number yet. So it may not be known until at the end of first quarter of 26. The conversations are starting though now on what is the steering committee and WASOLFO members going to advocate for internally as far as a process on how those reductions take place. The 4 million could increase or decrease as well. So just wanted to let you know that's on our radar, but it's just in the early stages as far as what that possibility will look like. And so we don't know the exact impact to the health district just yet.
And then just to add also, we have been notified by Department of Health and other grant categories that we all are also expecting reductions to those. Some of those awards have already been made, so some of them took effect July 1st. We're expecting in EPH, we're expecting to hear of a reduction. We thought they were supposed to come out mid-October. We have not heard yet. Should be hearing something by next week, but there will be a reduction in at least one of our grants through that, which we'll be able to cover within EPH with other resources right now. So we don't see that impacting us, but I could see that possibly happening throughout other state grants also as well. So nothing on the radar yet, but it could be coming.
With the foundational public health funding, if I understand it correctly, there was a cut in the legislature last year of 12 million per year. And now we're looking at potentially another 4 million. So that's, yeah. But But of that 12 million for this the state's fiscal year, we only saw $170,000 or $150,000 change, because that's spread out all across all the health districts and DOH, right?
It did.
So it'll be interesting how they negotiate what happens. I had a chance to talk with Jamie Bodden, the executive director of Wasalfo, just about state and federal issues and how their process is going with choosing their priorities. And she said that it was this particular fund that funds public health. They made some changes to it, and maybe it was like the vaping and other
The structure,
taxes.
yes, the structure, the way I understand it, was changed from inception with FPHS to also have a component of dollars from the vaping revenue tax, and that has been coming in less than. So it's had a negative impact with this structure change that maybe was not intended consequence of the change, but it was a lump sum or a dedicated amount, and now it's tied with the vaping revenue, and that's causing the reduction in the forecast.
So MPHS, as she explained it to me, has state general fund dollars, but also this vapor fund, taxes, I guess, on products, which was new, right? That was a new way the legislature was trying to fund public health, but that fund is not it did not come in the tax revenue or the fee revenue as what was expected to date.
Correct. That's one reason it's unknown too. It's forecasted to be the 4 million
Okay.
reduction.
Yeah, and speaking to the 12 million, DOH took a heavier hit during that $12 million reduction. So I don't think that they're going to be in that same position this time. So that I think that there's going to be a higher impact on the local jurisdictions versus DOH this go around.
Okay.
Yeah, and it was a topic with Wasalfo today. They're putting it on the agenda to be almost a weekly meeting now, to get some of those, work with steering committee and give some feedback on where and how the reduction should be made across the system. Because foundational public health services is supposed to be foundational across any entity and agency across the state. So how much leeway does each agency have for making the decisions of reductions? Because there is a baseline of services that the intention is to have them across the state. So really early in the conversations are going to be tough conversations, but that process is starting now, but the total dollar amount is still an unknown.
Okay. All right, so let's move on to the unpermitted food vendors topic.
Okay, so how does this work? This?
Right here.
This magic. Okay, so hi, I'm Jessica. I am the Food Safety Program Manager in the Environmental Public Health Division with Ray. I have a lot to say, so I'm just going to be somewhat high level so you guys have a chance to ask some questions. But what I want to talk to you about is the somewhat epidemic of the unpermitted food vendors that you're finding on the sides of the streets, pop-up tents, carts. We're seeing a lot of fruit vendors and tacos al pastor is the two common ones that we're seeing across the state. Of course, they need a permit to operate a food establishment, and these are the codes that are associated with that. 8300 just says that if you operate a food establishment, you need to have a permit, and 8600 says that if you operate a food establishment without a permit, there is consequences of potential misdemeanor. So what we've done, when we are notified in advance, we send a team out. Last night we did this, and they issue the food establishment closure notice, which is that piece of paper on the right that says that you must close and not serve food to the public until you do these things. The invoice on the left is invoiced as well. Our invoice for operating without a valid permit is $360, and we just issue them over and over again. With the help of Michelle, we have gained access to Washington State Department of Licensing license plate reader. And what that has helped us to do is when the inspectors do the inspections for the closures, they can take a picture of the license plate of the car that they are putting the food in or taking the food out of. And so with that, we have found 2 owners through the license plates, and we sent out cease and desist letters and copies of all the closure notices we've issued and all the invoices we've issued, and just totaled them up. And we had success with one. He did come in, he met with me, he asked about permitting and all the things, and he did end up paying his invoices, which totaled over $1,500 because we kept, issuing that. The other one we are not as lucky with. That is the Tacos Al Pastor booths that we're seeing. We know who the owner is, just not having as much success. We did close that booth again last night. With that, some of you may have received the letter that we received on Friday, and it was a letter from the Washington State Mexican Restaurant Fair Play Coalition, and that is made up of about 200 licensed Mexican restaurants in the state of Washington, and they have come together to, urge officials to, close the booths. They want a task force developed. They're, threatening lawsuits and things like that. 3 of the members actually showed up unannounced here the other day and met with me. I actually went over this PowerPoint with them to show them all the things that we're trying to do. Because I think from their perspective, these are people that are hoarding in on their business and they don't have permits and it's not fair. Why do I have to have a permit? Why do I have to follow the code? And these people don't. And so I, explained the limitations of our retail food code and that what we've been trying to do. Anyway. The next couple slides are just to show you that, some of the public health risks associated with unpermitted food vendors. For example, you can see a bunch of chopped produce. We don't know where that's washed. We don't know where it's cut. We don't know if it's potable water. We don't really know any of that. You can see food just is out without temperature control, which is required to, prevent bacterial growth. We have chicken on the top just dripping onto the lettuce, beans at 79 degrees, and the temperature requirement for that is under 41. That huge Tacos Al Pastor concern there for cooking temperatures and things like that. Also, where is all the food prepared at? On the next slide, you can see mine is like freaking out over here. You can see the fruit vendors and that they're just draining the water out onto the ground. Massive, large outdoor food preparation, no food safety concerns. A theme you can see across all of these is there is no hand washing setup at all on any of these. Black garbage bags like that are not food grade, and they're just storing them in there at temperatures of unknown. This is a large production facility that King County inspected and closed. I don't think they actually closed, but those trucks and vans we are assuming is what is coming across the state with all the food. This is just on our downtown city streets right here, blocking the sidewalk, fire safety risks, no protection from elements for the food, all kinds of things. So far, we're seeing, some potential outbreaks associated. Just here in Spokane, just yesterday, we've received 2 illness calls, one from the hospital and associated with the Tacos Al Pastor booth. And then we're seeing that across. We had a S-Tech cluster in Yakima, King County that said that they were eating at unpermitted fruit vendors and just different stories about that. So I wanted to go through that really quickly because we have very little time, so I could answer any questions you might have. Please.
Yeah, first off, I think I'm sitting here feeling psychosomatically sick because
I'm sorry.
I ate one of those, didn't realize that
Okay.
the conditions. So it's been a while. I'm fine.
Okay.
But I guess my question is, so there's obviously going to be some effort at the legislative level to be able to do more. But in the meantime,
Yeah.
obviously SRHD has the food permit side and some enforcement mechanisms to a certain extent there. But on the city side, we've also got codes that regulate this, that
Yeah.
talks about needing a mobile vendor permit and a lot of other associated things. I've separately working on an ordinance to strengthen that much further. But the big question is there room for some sort of task force that could be a joint effort so that when you guys go out, you can obviously issue a citation on the food permit, but then the city can also be enforcing on the mobile vendor piece and all of that, because this is creating, as you could, I mean, a lot of issues downtown. It's a massive nuisance concern for a lot of folks. It's generating a lot of trash. And then, of course, the health concerns.
Yeah, we would love to do that. In August, myself and the technical advisor of the food safety program met with law enforcement, code enforcement, fire department, some city from.
DSP might
Where's
have been involved
Emily
in that.
from? Downtown Spokane Partnership. We met with them to try to kind of figure out, is there a way to coordinate this? It didn't come to much, but
Well, I think the challenge is oftentimes, and I was glad to hear you guys went out at night, because it usually happens at odd hours, weekends,
Exactly.
which, for some there might be some ability with the inspectors to go out, but with the city side, it's oftentimes more challenging.
Yeah.
And trying to make that work.
they actually mentioned that they don't have the ability to issue overtime for officials to do that. We have a flex schedule, and it does take away from their work. You know, they have routine inspections that they need to get done. We send out 3 inspectors last night, mainly for a safety component. And because they're at night, they're in, neighborhoods that might be more crime. I called Crime Check right beforehand and let them know that we were doing that, but they can't promise anything. And so, but we do notify them when we do that. Yeah.
Well, I'd love to talk more about what that could look like.
Okay.
Just, can you tell people what they should be looking for when they go to one of these vendors that does have a permit? Is there a place that it's posted?
Yeah, we do issue permits like you saw on the one slide, and they are required to be posted. And a lot of the permitted fruit vendors, the ones that actually did get permitted, have been posting their sign because they look exactly like the ones that are unpermitted. And so there's that to look for. If it's a pop-up tent, there is no permit for that. So that right in itself is a clue that this is not permitted, because we don't have a permit allowance to have a pop-up tent on a street corner. Pop-up tents are all for community events, Pig Out in the Park, Spokane Interstate Fair, those kinds of things, not on the street corner. If you're not seeing a hand washing sink, that's a big clue, because we would require a hand washing sink. So, yeah. Good question. Thank you. Any other questions?
Can I ask, I'm just gonna throw out an example. They have like a hot dog cart, but they throw up a pop-up tent for shade. That would be different, right?
Yeah.
The cart could still be permitted, and they just have that
Yes.
pop-up tent for shade, right?
So they're actually not supposed to have a pop-up tent necessarily if it's a permitted mobile unit. They're required, you'll see the umbrellas. It's supposed to be attached to the actual mobile unit. And it does provide shade, but it also provides protection of the food. And that is the requirement in the code, is that it protects the food from the elements, birds, weather, whatever. And that's really the main reason for it.
Just one other question. Does this enter into a criminal space at any point?
Yes.
With 50 unlicensed stands, I'm thinking, and you get sick from one of these places, what recourse is there for people?
Yeah, the RCW on that page that I showed you earlier is the RCW stating that if you don't have a permit to operate and you are operating a food establishment, technically we can, not the health district, but the city can issue a misdemeanor. Law enforcement can, technically.
Yes.
Just a question. We have some opportunity to be a little bit more educational about this for our residents, to be able to, educate people about some of these things, like, hey, this is a big issue. The Spokane Regional wants to, alert you to this. These are some things you can look for. Some of these are permitted and totally legit places, but we just we need you to be careful and maybe some kind of marketing, I don't know.
Yeah, we have used our social media outlet to do that. National Food Safety Education Month usually is the topic for that is usually decided by World Health Organization, but our state decided as a state that we were going to use National Food Safety Education Month to promote not only the permitted food establishments and the great jobs that they're doing and what it takes to be a permitted food establishment, but the risks of eating at unpermitted food establishments. And that was the month of September. We worked with our communications team and it was, yeah, so we did that. And we posted a couple of other social media. Some of the other LHJs are having websites dedicated to it, whole blogs, posting every time that someone is getting an issue a closure. Tacoma will post, we closed 23 stands in a month or something, on their website. So it's just, yeah. Okay.
All right, thank you.
you.
We'll keep an eye on it, and I know that it's listed on the potential legislative agenda. So
great.
We can keep working on it as a community. So thank you very much.
Thank you. Thank you very much.
Appreciated all the photos. That was really helpful.
Okay, great.
Financial update. Maybe we can keep it real quick, Kim. I think all is okay.
Yeah.
I sure hope so. At least for this month.
Yes, it is. So I'm going to go really, really quick, and I'm sorry we just lost Councilmember Cathcart because we do have a follow-up for a question that came up at September's Board of Health meeting. So real quick, it's in your packet, September's financial report. We do have a surplus of $634,000 year to date, and that's the snapshot of where we sit today. We also have 20 million in reserves. We still have some reimbursements that we haven't billed for. Those get calculated at the end of September's month end. And so I was going to turn it over for 2 slides for Lola to briefly give an update on a question came up about capital projects and some of those reserve dollars with the energy projects for facilities. So unless there's questions.
Just ask a question really quick.
Yeah,
please. Can you just remind me, our reserves, where do those funds come from and how often are they put in there?
So at the end of any calendar year or every calendar year, basically, we have our revenues versus the expenses. And so we bill our grantors to the extent we have expenses. So we wouldn't overbill a funder, for example. But we do have some local dollars that if we didn't utilize or we found a different funding stream in that calendar year, we may have a surplus for that year. So they would automatically by design just go back into the unassigned reserves. And then each year, depending on what we're able to put into the unassigned reserves, we'll go through and evaluate what we might want to put into assigned reserves for the future. So and we always run a balanced budget to zero is what we try to balance, that there's no use of pulling reserves to balance our budget. But in some years we do have a surplus, and that allows us to put that in into the unassigned, and then the evaluation of just where would we put them on future projects. And so, for example, the building projects is $1,805,000. If that's an estimate, of course, and then when we actually spend those dollars, if it ends up being less, then we move those dollars back into the unassigned, and they would remain there, the unspent dollars.
Do you think we have a good amount in our reserves, or,
we're doing well. The state auditors look at the health of the district based on if we can cover 3 months of operating expenses. And so that's one of their criteria. The board had set for us to try to stay within 20% of our budget into our unassigned. And we're, as you can see, even at a partial month in September, having not billed all of the grants, we're at 24%. So we do have a cushion of about $2.5 million above what is 20% of our operating budget.
Has it been the same pretty much the whole time you've been here, or?
Oh, we've definitely been leaner before, where we haven't established the 20%, or we were dipping below where just on operating cash flow that on the surface it would look like they were dipping into the emergency reserves of $1.5 million because our cash balance was getting lower. So, but we've been we've been running, really budgeting 2-0 each year and really balancing that. But in prior years, we had maybe a $700,000 draw for the next year's budget. And so anticipating pulling reserves, and we've gotten away from that.
Thank you. And I know our new board members will get kind of the 101 about our budget and our capital versus operating, and be able to ask more questions. So thanks, Kim.
Yes. So if
Do
you
we want,
Lola, or
I'm
we can
cognizant
postpone
that
it.
it's 3:10 and we haven't discussed the proposed legislative agenda. And I just wanted to make sure everyone had a chance to just give input into that so that we can bring it back. Can we do this update next time?
Sure.
Lola?
Yeah.
Okay. I know there was a lot of work going on the outside of the building all summer, so.
Well, it's been going on since 2021.
It's a big building.
It is a big building. No, and it's kind of good just to pause and take a look at it. We've got a lot of folks that are involved in that process. So for those of you that are new to the board, and welcome, what we do internally each year is that we reach out to staff, specifically program staff, and we say, what things are your clients, is your community needing? Things that maybe we can bring to the legislature. And then we gather that information, we bring it to the committee. And then the committee sort of hones that with what they're also interacting with around the region. And then eventually this will be shared with our WSOLFO partners. So we'll go ahead and get started. For the first portion of this, I'm going to read through this very quickly rather than going into all of the detail. Hopefully you do have a copy of what our current draft looks like, and will be refined eventually and turned into a brochure.
8C in the packet. Yeah.
Excellent. So for workforce development, basically SRHD supports strengthening Washington's behavioral health workforce through expanded training, scholarships, and loan repayment, focusing on rural and underserved communities. We advocate for cross-training, expanded adolescent mental health capacity, enhanced law enforcement, co-response programs, and standardized statewide training to ensure a qualified, sustainable workforce. Under the substance use and fentanyl response, to condense this, basically we're saying that we, as the district, support expanded treatment and recovery services for substance use disorders, ensuring state funding, that was probably a bit of a slip, is directed to programs with measurable outcomes and requiring transparency and evaluation for all grants to promote accountability and sustainable recovery. Under our youth mental health, SRHD is urging the investment in youth mental health programs accessible to all children, with increased funding for school and clinic-based care coordination and child and adolescent psychiatric services, protecting youth from opioid and fentanyl exposure and fostering strong prevention partnerships that are crucial. Under our community access and resilience, SRHD is supporting funding for translation and interpretation services to ensure equitable access, and investment in navigation programs that help residents complete applications, verify eligibility, and overcome literacy and technology barriers. Under healthcare administration, SRHD also supports funding of administrative support staff and technical assistance programs to strengthen system efficiency, integrating navigation services, consistent training, and standardized data metrics to improve outcomes and transparency. And under community health and rural stabilization, we are urging an increased support for rural health programs through expanded funding and telehealth, integration of providers and educators for disease prevention, PFAS remediation with transparent monitoring, and stronger enforcement for food regulation to protect public health. Questions? I know I zoomed through that.
I'm not totally sure that I understand our, when we have these legislative priorities, what happens to them from this, presentation to us? And then what happens after that? What's attached to this?
So
How is it communicated or?
Right. So last year, we had a document that looked like this, although it must have been 2025, not 2024. But we adopted in 24, right? So this would have been last year's. This would have been, okay. I had Ann email me some of the past so I could just review it. I'm happy to ask if you could maybe send out a couple of examples of, just so you can see in the past, especially for new board members. And I feel like I'm still new as well, only in my third year, kind of what the past practice was. But I think my understanding is that this helps support and give guidance to Wasalfo about our priorities, right? And then we can take this as individual board members and we can advocate on any of these, and staff can educate, correct? Can educate about why, why the focus on like mental health workforce is so important to, impact certain health outcomes. Is that a good overview of kind of staff can't directly lobby, but board members can be more involved?
100%. Yeah, the whole lobbying analysis is pretty in-depth, so it's hard to summarize who
I think
can do
we
what.
often say that we advocate and educate.
Right.
But don't try to avoid taking a stance on a particular bill, right?
Right. Yeah.
Yes.
And I'm happy at some point to do kind of a presentation on that for everyone, if that would be of interest, because it would be complicated.
Yeah, I think just getting the idea of the soft lobbying versus lobbying and where, because you can go to Olympia and advocate and they're discussing particular bills, I think at that point. So I would like to hear more. Okay.
Commissioner?
Yeah, so several years ago, the legislative agenda from the health board was very statewide focused. It was sort of the same asks that you'd see from Wasalfo. And so a couple years ago, we made the decision, let's try to craft SRHD's actual legislative agenda. What are the needs of Spokane County, the needs of the departments here? And so if you look at some of the really old ones, you'll see a shift to what it is now. It's very focused towards what the actual needs are for this community. And so I think after we've adopted it, previous years, we've tried to mail or email copies to our local legislators before they get to Olympia. And then if any of us are going to Olympia, we can get a hard copy to have with us that we can also hand deliver them, to the legislators when we're over there as well. And I don't think any of the board members here, I mean, unless your employer prohibits you from lobbying, we don't have any, there's nothing that prevents any of the board members from lobbying any of those legislators over there. But health district employees are, that's where you get into that gray area, I believe.
I think to be a lobbyist, though, you have to be registered and all that
Yep,
stuff.
but that's only if you reach a certain level of lobbying, and I believe if there is any type of exchanging of dollars to do that lobbying. I mean, if you go over as a citizen, Patricia Keenholtz, I'm a member of the health board, this is what I would like you to support, vote yes, vote no. I don't believe you're crossing any lines doing that, so.
As long as you stay as your individual person, you can do that. But,
Okay.
but we'll go, like I said, I have 2 pages that I spent trying to map all this out, so I think it'd be great for us to
let's
talk
plan
about
for a
that.
little training on that. That'd be great, especially we have new board members coming on. It's good timing. So one question I had was, previously we had this introduction page where we kind of list all of our top priorities. Were you planning to retain that, which starts with the introduction?
Yes, so we'll share this, now that we've reviewed this with the board, we'll share that forward to our communications team. They will make it back into the latest and greatest version of the brochure you're holding in front of you, which will include the introduction and all of those fine points. So.
Because I was just going to say, we should probably say supporting state funding through the general fund and other funds, since now it sounds like there's other funds. So just a note of that. And then when I talked to Jamie from Wasalfo, I said, well, what are you guys leading with? What is the number one ask? And she said, maintain foundational FPFH, right? Maintain foundational public health service funding. Since it's already been cut by 12 million, we want to make sure the legislature, her concern is, which I think is ours, having to make more cuts this year, which it sounds like some of that might not be able to be avoided, but we wouldn't want to see any additional cuts. So I would suggest to the committee that we might want to lead with maintain foundational public health funding, knowing that it's already been cut in this 2-year cycle. So that was just my suggestion, maybe lead with that and then have all these other areas that are more like why we need to continue that funding. But that was my suggestion. She said that, everyone, all these public health districts, we all have our priorities and we all want things, but it's going to be a really tough session. So that was just her suggestion. So I didn't notice that in the draft, so I just was going to bring that forward.
No, I like it because I'm, just the meetings that, in fact, I had one earlier this morning. That's what we're hearing across the board with our LHD partners out there. So is also the concerns about.
And I know we're getting late on time. I looked back and I know in the past we've said support. I'm looking at one of the past support. Access to care. And it wasn't in the last couple versions, but like previously we had always had a statement about access to care, making sure everyone can access healthcare, in the community. And I'm just wondering if we might want to bring that back in again, knowing that there's been some changes to the Medicaid and Affordable Care Act funding. So that's just we may want to just have a section on people need access to healthcare. Maybe we took that out because a lot of people were getting access in the last 2 or 3 years, which was great. So those were the only things. I really like the inclusion of the PFAS piece and the food safety, right? Dealing with some of these pop-up food vendors and making sure we can keep people safe. So I thought those were great. So great job. I think the committee is all left, but thank you. Thank you, committee. I think Charlie was on the committee as well, who couldn't be here today. So thank you. Can I just email in those suggested changes?
That'd be fantastic. Yeah.
And if there's any other ideas, and Anne, if you could email a couple past ones, maybe I can just suggest which ones that you sent me so that new board members could see what we've done in the past. Okay, great. So send in all edits to Lola so we can have a final draft to decide on in December.
Perfect. Yeah.
Okay.
Sounds good.
All right. Well, we unfortunately we always leave you with hardly any time, Dr. V. I am so sorry. Do you have a quick measles update or anything?
No. Well, I do. I was going to talk about domestic violence, but I will leave you.
Oh no, go ahead. Go ahead. I saw your
I'll go very quickly.
I saw your guest
Okay.
editorial in the Spokesman. Great job.
Thank you. So I'll go very quickly. I just wanted to highlight the fact that October is Domestic Violence Action Month. Notice it doesn't say awareness, it says action, which is how we're approaching this nowadays. And the reason why I bring this up is because unfortunately it's a conversation that we need to continue having in our community for the purposes of awareness, education, and access. And this is not something that is new. I'm not going to read through all of that, but we started to look at domestic violence more systematically about 1978 as a result of a commission on civil rights that gave birth no pun intended, to the National Coalition Against Domestic Violence. Since 1987, we have been celebrating or using October as a month to increase awareness about domestic violence. And I will leave you all of that so you have the history. Now, when you look at the definition of domestic violence from the U.S. Department of Justice, fairly broad. And one of the areas that has been increasing dramatically in the recent past is technological and or digital domestic violence. When we talk about domestic violence, immediately people think about physical. Not the case. It's a very broad definition that includes behaviors as well as manipulations from a financial perspective, etc. Cyber stalking, cyberbullying, altering someone's digital persona for the purposes of either causing an insult or injury, et cetera, et cetera, et cetera. I would encourage you to read that. And if you actually look at the literature of the last several years on digital and technological violence, it's totally mind-boggling. And it brings you back to a statement I made before that we're really good at coming up with great solutions for things, but unfortunately sometimes we use that technology for not so good things, because we all know that digital technology is really good for a lot of stuff. Anyway, so basically what it boils down to, if you look at the top paragraph, about half and half of male, half of females, have experienced some level of violence in their lives. It's 47 and 49, but we roughly call it about half and half. That basically means that about 20 people per minute are experiencing one of these items that is highlighted definition in the US, and it varies by country, but I'm focusing on what we do here. Unfortunately, that also means that about a quarter of all children under the age of 18 have been exposed to an act of domestic violence in their environment. And we're going to talk in a little bit, why is that important, particularly for children and young adults. Now, when you look, this is totally psychedelic here. You cannot read my screen. But I can tell you that in Spokane County, last year we had about 7,000, give or take, that were reported. When you talk to law enforcement and others, they will tell you that these numbers are probably under-reporting because not every case is reported and or documented. So we don't know what the actual number is, but it's pretty high. We're much higher than the state, and we have been much higher than the state for quite some time. And unfortunately, we also have a much higher rate of child abuse and neglect than we see in the rest of the state, which is one of the things that surprised me when I came to Spokane, just because I knew it was a very welcoming community with people caring for each other. But it's one of those realities that we have to talk about. Now, in 2023, about 25%, one of every 10th graders, have seen a instance of physical abuse at their homes and or environments. If you talk to our friends from K through 12, they will tell you that that's probably a little higher. And then these children, unfortunately, do develop behavioral patterns that will make it more consistent with them being either someone that incurs domestic violence or has post-traumatic stress. It usually you see it in the classroom with quote unquote poor behavior and or behavior that is not consistent with the classroom. Nowadays, I think our K through 12 educators are very astute about identifying some of those signs. It used to be that in the past it was, well, you're not behaving. So it was punitive as opposed to trying to address what the issue is. We still have a long ways to go there. We still need more tools. Unfortunately, sometimes when we identify these children, particularly in Eastern Washington, we don't really have access to treatment for youth and young adults and children that is readily available. So if you talk to our K through 12 folks, you'll talk a lot about that. And I'm focusing a lot on the K through 12 because a lot of what happens to these children sets the pattern for what's going to happen to them later and what they may do later in life. So the earlier we can intervene, the better off we're going to be and the more we're going to be able to prevent. Now, it is important that we all know that there's tools and resources. We do have a lot of those in our SRHD website. not only the Family Nest Partnership, but a whole bunch of other places. I use actually my first live was from YWCA. I did a Facebook Live with Gemma Rydell from the YWCA. We do that every year. And they have a lot of services, but there are also a lot of organizations around town that have services. And we've actually posted that on our website and in the various digital access that we have. And the reason why that is important is because you may not be the victim of domestic violence, but you may know someone, you may suspect someone, or you may be wondering about someone. So the first thing that I encourage everyone is you're aware, educate yourself, and then determine the best way that you can help. And sometimes it's providing support, sometimes it's providing guidance, sometimes it's just as simple as this is the hotline number. I think you may want to call today and sit here if you want me to sit here with you while you call. So very important issue. I know we don't have a lot of time, but I wanted to leave that for the record with us because it's one of those things that we do need to stay focused on. Because again, this is the optimist and eternal optimist in me. I know we can do a lot better. And I think education, awareness, and access are the three key components of that. Any questions? And I will also tell you, I do a lot of cooking. So for the record, I have 7 cutting boards that can go in the dishwasher. I wash all my knives at 190-degree temperature water. And I use milk for chef's grade disposable gloves for prepping and 5 to 6 mil for cooking.
Well, get him a permit.
For the
All
record. And if you don't know what mil is, thousandths of an inch. It's this thickness. Questions about, no, all kidding aside, we are at SRHD, we're focused on what more can we do about this from an education and awareness perspective. It's important. Questions? And measles, yeah, we had, yay. And I will come back to probably the next time or the time after with a full report on how we contain what could have been a significant outbreak of measles a few weeks ago, which if you recall, we did that last year too. Mm-hmm. So I'm going to come back and tell you how we do that and what the numbers are and what does that mean. Thank you.
And I know we'll have an update. Unfortunately, the flu is back and you guys are monitoring that and,
oh, yeah.
And we'll have some more updates next time.
Next
All
time,
right.
yeah.
Thank you so much. All right. Well, we tried for 3:00. We did our best. So much information, and I appreciate everyone who's able to stay and hear the staff reports. So if there's nothing further from any of the board members, any announcements, we will adjourn the meeting at 3:32, and we'll see you back on, is it December 4th? Is that the next meeting date? So just remember, we don't meet at the end of November, we meet the next week.
That's correct.
First Thursday of December, 12:30 p.m. here. All right, thank you.